Guys live right now.
Excellent.
Hold on
Thank you.
1 second. No problem. And you guys are live.
All right, excellent. We're gonna call the meeting to order at 7:01. Quick roll call. We have Dominique Johnson, Tom Keegan, Diana Revolus, Nick Sachinelli, Lisa Shanahan, and George Cianidis present. Manny Langilla is absent this evening for the record. Let's do the approval of the February 20. Dominique, was it the February meeting minutes that you had there? Perfect. All right, so we'll go into that, but I know already Dominique found some errors in there. So approval of the February 25th, 2021 meeting minutes. Is anyone want to move that? Oh wow. I think I saw Diana first. I saw Diana first. Corrections.
Well,
Yeah. Please.
Hi, thanks, Chair. Actually, the meeting minutes I found a lot more issues with was, my apologies, but for January 28th, but I did see one for February, and that was, my name was misspelled slightly, just missing an I. That's
okay.
all.
Is it the beginning of the minutes? The
Correct.
The actual
Yeah.
roll call? Okay.
That's right.
So we'll update the records to correct the spelling of Ms. Johnson's name for the February 25th meeting. We have a motion on the table. All in favor? All right, unanimous. As there are errors in the January, is anybody like to propose a suspension of the minutes to re-add the January meetings and make an amendment? Ms. Shanahan, Ms. Johnson, did you want to read in the errors from the January?
I do have errors. They may be substantive enough to submit in writing, if that's more effective use of our time, or do I have to mention them now?
I think that's a good question.
Yeah.
Well, we opened it, so we can submit the so let's vote on the fact that there will be errors submitted in writing. Is all in favor of the corrections that Ms. Johnson is going to submit?
Cool.
All right, unanimous. I think process wise that's okay.
Y'all can trust me. I appreciate it. Yeah.
If not, I'm sure someone will yell at me at some point.
It's all good. Whatever you think's best.
Do we have anybody on for public participation?
Nobody with their hands raised, so I can wait a few seconds to see if anybody raises their hands.
Yeah, I see two people in attendance. If you'd like to speak publicly, please raise your hand digitally. All right. Moving on. We do have the standard discussion items, but in order of operations, we have 2 items to add in advance of the discussion items, if everybody's okay with that. So I'd like to make a motion to suspend the minutes to add a police item as well as a health department item. I have the police item that I could read in, and Deanna, I know you sent it over, but do you have the health item? Okay, well, I'll read the police item in first. Excuse me, sorry. All right. Nope, I think that's nope, it is. Authorize the mayor, Harry W. Rilling, to enter into a lease with Second Taxing District for the purpose of installing and maintaining radio communication antenna and equipment for their existing tower for initial term of 5 years with 5 successive 5-year renewal periods. Somebody want to speak to that? First of all, would anybody like to?
I'll move that, Mr. Chair.
All right, thank you. Deputy Chief Zaka, do you want to just speak on that briefly?
So as you guys are all well aware, we've been moving this citywide radio project forward, and this is one of the initial steps in terms of really getting it off the ground. Is we had to determine the coverage area. We've historically had issues with our radio coverage in Rowayton, and that's part of why we would be moving toward the state system. And in order to get the proper coverage, the vendor and the state have evaluated where we would get the best coverage, and we determined that this site would work to improve the coverage and make the system operational. We've met with second taxing district, and have come to an agreement on with the space, and we would like to move that forward. The final details of the lease agreement are being worked out with the law department, but we're just about there. So we wanted to move this forward at this point.
All right, thank you. Discussion, questions? All right. We have a motion on the table. All in favor? All right, it's unanimous. Thank you. We'll move on to the health department item. Deanna, I have the requested wording. I'll read that in and then I'll pass it to you. I know that you circulated the looks like a 10-page document as backup, but I know you will probably want to speak on it briefly as well. So I guess I moved both items together, so we're good. So the next item would be authorize the mayor, Harry W. Rilling, to execute a license agreement between the city of Norwalk and BTC Norwalk Region LLC to use and occupy on a temporary basis the building located on 64th North Main Street, Norwalk, Connecticut 06854 for the purpose of administering COVID-19 vaccinations. Would anybody like to move the actual item? I see Ms. Johnson. All right, and then Deanna, the floor is yours.
Thank you so much. So we're really excited about this partnership. We've been vaccinating in several different locations in Norwalk, and we felt the real need to have a location in South Norwalk to be able to be accessible to many members of our community. And we're so excited that the Bowtie Cinemas wants to partner with the city and to offer this location. And we're just excited about it. We'll be able to be there. They're very flexible with the hours, so it can be, again, accessible to people, especially with the ages now opening on April 1st to everyone 16 years of age and older. We know there's going to continue to be a big demand for a vaccine. We'll be able to have a high throughput in that location. So we're just super excited about it.
All right, any questions? I should mention that this obviously has some, we'd like to move quickly with getting this operational. So there is a likelihood that we will be calling a special council meeting to vote on this formally to move it forward in advance of the next council meeting. So I just want to put that on everyone's radar because next week is the 5th week of the month. So we don't often have overlaps. So keep an eye out for an email update to see if we are able to schedule that. I think, is there any objections in this group? Is there any conflicts or anybody traveling or unable? Okay. All right. So I'll make sure that that's coming out. So if there's no questions, we have a motion on the table. All in favor? All right. Unanimous. Everything just streams right through. This is good. This is good. All right. So we have we're moving on to the discussion items.
Nick, excuse me, I believe Ms. Revelou has a comment or an objection.
Oh, I apologize. Ms. Revelou.
It's just not unanimous. I don't have nothing to say. It's just not unanimous.
Oh, I'm sorry. I apologize. So
No
actually,
worries.
let's call that vote again. I apologize. So we have 1, 2, 3, 4 in favor. Any opposed? And opposition or abstention?
I'm just abstaining.
Okay, perfect. One abstention on the record, Ms. Revelou. My apologies. All right, so moving forward, we have the discussion items. So emergency management update is first on the discussion items. Michelle, is that you?
Sure.
All right.
Just a few quick items. Obviously, we continue to support the food distribution on Wednesdays at Vets Park, or I'm sorry, at Calf Pasture. We do recognize that at some point we will have to shift the location for that, most likely either back to Vets Park. We still don't have an end date from the Connecticut Food Bank food share. So hopefully, as long as they're able to provide the support and provide the food, we'll continue to host this weekly event. And again, if we have to change location, we'll make sure that's announced well in advance. But we do seem to be getting almost the maximum, which is about the 1,500 cars coming through each week. So we know the need is still there. Keeping track of the updates that are coming in from FEMA and the state and making sure that our partners are getting notified of that. So soon to come will be an announcement through or from FEMA regarding reimbursement for funeral expenses for patients that pass of COVID. So we will make sure that, again, working with Josh and all of the partners, that information does get out. It will be a direct reimbursement and request to FEMA. So again, the city will not be really involved other than sharing the information about the 800 number and really encouraging residents that did have a family member pass to apply. And we'll make sure that information is shared in multiple languages and multiple venues. My favorite time of year is the start of hurricane season. I tend to get overly excited about June 1st. So we are again planning our annual hurricane exercise. We'll probably either do that virtually or as a hybrid, with some folks being able to participate in person and others, if they're not comfortable, doing it online. We typically have been doing something to kick off hurricane season for the past, probably 10 years, if not more. And then also working with the American Red Cross to do some youth-focused programs, one for the little ones and then one for probably 4th and 5th graders, also encouraging preparedness. And again, that's all tied into the start of hurricane season. So thank you.
Excellent. Any questions?
Does the person who passed from COVID have to be a resident, or does the person who experienced a person passing have to be a resident?
Resident of the United States?
No.
No, but it'll be a national program.
National. Okay, cool.
You have to be a citizen to apply, but again, we'll make sure we get all that information out. So again, it'll be open to everyone in the country through that 800 number. And it's up to $9,000 for the funeral or cremation, and then up to $35,000 for the overall expenses. So that would include the funeral home and all everything kind of before and after. So it is a pretty significant amount of money that will be available. So we want to make sure residents, especially those that are financially impacted or were most impacted, do have that opportunity to apply for those funds.
Thank you.
Ms. Shanahan.
Are there income restrictions or anything like that, or is it open to?
That I'm not entirely sure. I didn't see anything in the preliminary announcement. But again, once the 800 number gets released, and I think that will be in the next probably week or two, hopefully they'll give some more details about the application process. Thank you.
Any other questions? All right, Mr. Luca, thank you. Fire update and discussion. Chief, you're up.
Thank you, Mr. Chairman. Good evening, everyone. I'm going to give you a rundown for the calls for the month of February. We had 462 calls, which averages out to 16.5 per day. 12 fires broken down into 2 chimney fires, 6 vehicle fires, and 3 rubbish fires. 24 rescues, which included motor vehicle accidents with injuries, without injuries, extrication versus pedestrian. 290 emergency medical calls, 20 hazardous condition calls, 19 public assist, 28 smoke scares, 69 alarms, which included unintentional, malicious, and malfunctions. That's the calls for the month. The fire marshal office summary is 65 inspections for the month of February. 40 notifications were sent out. They did 1 public education event, 13 plan reviews, 9 liquor license, and they had 4 fire investigations. And the month brought in a whopping $1,335 revenue. The update on COVID is actually good news. We still have 2 people out with some mild symptoms, but we don't have any new cases and we have no one in quarantine. And just a quick rundown, today at the firehouse, we had a press conference with the mayor and several members of the clergy. And we just had the kickoff announcement for the entry-level firefighter exam. So that was pretty well received. The media was there. And then the last thing I want to mention is April 1st is the Autism Awareness Month. So we're going to participate with Jeff Spar, we have an engine and our command car at the town green. And thanks to Michelle, we're going to light up the building blue for the month of April. That's my report.
I caught myself. I caught
Yeah,
myself. Thank you, Chief. Any questions for the Chief? Chief, I saw a notice about the recruitment and the testing coming up. How's the recruitment been?
Yeah, the recruitment is, we're doing very well with the recruitment. We just went live maybe a week or so ago. We have quite a few applicants already. So, and then today's kickoff is going to really, I think that number is going to probably double by the time we're all done. So it's going very well.
Excellent. All right. Well, Ms. Johnson.
Thank you. The chair asked a question I was very interested in, and I know that you're especially wanting folks who are entry level. So I saw from information shared today, it looked like you do not need a high school diploma, but a GED. Is that right?
You do need a high school diploma. You need a high school diploma or
GED. I apologize. Yes, that's absolutely right.
One or the other.
High school diploma or GED. So if you're a current high school senior and you're graduating, you can apply. Is that right?
As long as you're 18.
Okay.
You have to be 18 to take the written test. So if you're 18 by May 22nd, you could take the test.
Great. Thank you.
But if you're 17, turning 18 in June, unfortunately, we can't let you sit for the test.
Okay. Okay. Thanks for clearing that up. I didn't want misinformation out there on my part. Thank you.
You're welcome.
Mr. Evans, I see your hand up.
This just makes me wonder something. Are people limited to applying if they have a criminal history?
I'm sorry, what criminal history?
Yeah.
Well, if you have a felony, it'll be a little difficult to get hired if you have a felony. We're not going to stop you from taking the exam. It's all really up to the fire commissioners to decide that.
Do we give lanes to help rehabilitate people in those manners for these type of opportunities? I can understand a felony, but I just thought about it right now. I should have said this a lot earlier, but things like the police department, the fire department, so on. Maybe if it's not a felony, but if this is a way of getting yourself into a very different lane and change the life of somebody and get them rehabilitated, maybe a slot for 1 or 2 characters, 3 characters, just to start, might be.
Yeah. That's a good question. They do have in the state of Connecticut a second chance law.
Right. Right.
Unfortunately, they have to take it case by case because,
right.
obviously we're trusted by the public. We go into people's homes when they're not there. So every individual's background and criminal activities, all that is investigated.
Right.
And then it's discussed at that point.
I can completely understand them being extremely scrutinized with that,
Yeah.
but the chance, the opportunity, even if it's a 1-2 slot thing, just doesn't have to be now, but if it's a possibility, you know.
No, it is a possibility.
Yeah, but I understand that they should be, and they should be. That's part of helping, that the being strongly scrutinized and in a positive manner. But yeah, of course they should be. You know, of course.
Yep.
Yeah. That's all.
Thank you. Any further questions? All right, Chief, thank you so much.
You're welcome.
We are on to Health Department updates. Ms. Diamore.
Hi, good evening again. So as you know, most of our focus this past month has been on vaccination. We've now administered over 7,000 doses of vaccine. Norwalk as a whole, some update on some numbers I just got updated today by the state. 26% of our population has received a first dose of at least one dose of vaccine. For our 75 and older population, 84% of them have received a first dose. And the population between 65 and 74 is now 89% have received. So for those two, the 65 to 74 and the 75 plus those are both above state average. We are a little below state average when it comes to total population, but we do have a younger population than other areas of the state. The governor just announced today that he will be opening up to all ages 16 and older starting on April 1st. And so we know that there will continue to be a big demand for the vaccine, but they are anticipating that over about 50% of those 45 and up will have received a first dose by the end of next week. And so that's really their threshold when they determine when to open up to more. We continue to monitor the cases. They are trending up. The past couple of weeks they have trended up. So we will see the end of this week where we are, if they are continuing to go up or if it was a blip. But we know that there are variants circulating within the state. And so that's something that the state is closely watching, and they're releasing reports on variants that are found within the different towns in the state. We already talked about Bowtie Cinemas. That's our biggest news, and we're excited about that partnership.
Thank you. Any questions from the committee? Ms. Shanahan.
So, Deanna, I'm kind of interested with the vaccination rate being so healthy and robust, which is fantastic news, but our cases going up. Do we have a sense of the cases are going up, but people are getting less ill? Is there any kind of correlation that you can make about the vaccination rate and the increase of the disease?
It's the younger populations that haven't had access yet to the vaccine where we're seeing cases go up.
And how do the hospitalization rates look with that?
Within the state, they have been going up within the past few days. They are seeing some more hospitalizations amongst the younger population. So it's, again, it's like a race, right, to get vaccines into arms as quickly as we can while we have these variants circulating as well.
As far as hesitancy goes, how are we combating that? Because there still is a unfortunate number of people who are very concerned about the vaccine.
Yeah, actually, so Teresa Argandesi, she's our new Assistant Director of Health for Community Health. She's on attendees, and so she can speak a little bit more about that. Anthony, can you add her to the panel? Oh, he's still on or not, but I can start, and then if he's able to add her over. So as you know, the mayor has been having forums, with trusted voices and, experts from different communities speaking. So there's a lot of effort on that end. And we're also, sorry, I'm trying to organize my thoughts. So part of the hesitancy is trying to, again, some of it is about, we're hearing about, insurance status, will that impact your ability to get vaccines? So some of it is that, some of it is just trying to make the decision for themselves whether they want the vaccine or not. We are seeing that the more peers get vaccinated, some people are hesitant at first, and that the more they know someone who's gotten vaccinated, we're seeing as time goes on. But we also have a community health workers that we're working with the Family and Children's Agency that have been working on that. And Teresa has been doing messaging as well. I wish she could be joining us so she can give more details, but.
Good start. Thanks, Deanna.
Anthony, are you still on from IT?
Sorry, I was muted.
Oh, no, not a problem. Could you let Teresa into the room as a panelist?
Yes, hold on.
Please. Thank you, sir. I don't know if Teresa, welcome. I don't know if there's anything that you wanted to add to that, but I know you were locked out of the conversation, so you may even say something.
No, Deanna did a great job. We're trying to do as much outreach into the community and bring information in through other trusted messengers. So not just the health department, but our other community partners and the community health workers that we work with at Family and Children's Agency they're actually wrapping up an information session right now for an organization that requested a Zoom call. And so they're able to provide that information in Spanish and Haitian Creole, both, in a Zoom call, but then also helping us to translate materials. And so I think slowly but surely we are starting to reach out to folks, and get the word out through other partners and through other community messengers rather than just the health department. And I think we are making some inroads there as well. But yeah, Deanna covered it all.
Thank you. Are there any other questions for the health department? Ms. Revelous, did you ever hand up before? I don't know if
Two, one is always going to be the same, nutrition. But secondly, I was just wondering, I'm just thinking if there is what is this data that's showing on the increase for youth? Just wondering, especially being in multi-generation homes, if there's a vaccine happening with elders and youth are now going up in numbers, is there a correlation with their interaction in that?
Between a youth and
coming, yeah, like our elders have been vaccinated, right? We're in homes that are in multi-generations. And then we're talking about youth who weren't really in the beginning now coming up. I'm just asking if there's any correlation to the exposure of a youth being next to like an elder who was just recently vaccinated.
No, so we're hearing about, well, we did start seeing increase in younger populations, if you remember, over the summer and through the fall. And so, so we aren't seeing anything related to that but what we are seeing is as we're starting to open up, as people are traveling more, we're seeing some of that. We're seeing and the variant is just, it's more some of the variants are more transmissible. So it's what we've seen in this last wave. It started going up really back in September, and it peaked back in like December, January, and then it started going down again, and then it plateaued for a little bit, but it never actually went down far enough. And so there was still a lot of virus circulating, and it plateaued for maybe a couple weeks, and now we're starting to see it come back up again. And we'll know within another week or two or so where we're going.
And also knowing, again, because it's great that you guys are out and being informative, but we do know, and by science standards, that this virus is between a 5.5 in its pH levels. And again, bringing nutrition to get bodies above that pH level would definitely be most effective in all that we just said. So when nutrition comes to be a part. And if we're going into places like movie theaters, I just don't know why we can't have that nutritional aspect connected right in people's hands there. Because quite honestly, it already came out. This is at 5.5. You bring your body above 5.5, you will have a better experience. So I just think nutrition should be right in the hands of people if you're vaccinating them or if you're not, period.
That's a great point. We actually have started to do some in-person outreach at the Calf Pasture Beach food distributions that are specific to SNAP enrollment. So to help folks who, once the food distributions are over, some other programs that might help them bring some money in to get healthy foods at the grocery store. And as part of that, we're trying to complement that food distribution with nutrition information about how to cook healthy with pantry staples, how to, stretch your dollar and still eat healthy. And that has actually grown into a collection of resources that we're putting together into a website that includes budget-friendly nutrition information, but also immune boosting nutrition information, recipes for kids, recipes for the whole family, how to eat healthy when you're out. And so there is a collection of information that's being generated. And then at the food distributions and other community events, we're developing postcards to direct people to that information with a QR code, the link, and that sort of thing, so that they can kind of see a whole catalog of information. Harvard recently, their School of Public Health recently put out a healthy living guide that includes lots of health and nutrition information, including ways to boost your immunity through nutrition and physical activity. And so all of that is going to be incorporated into that work.
And just to add to that too, so we were at the movie theater today, we're looking at those screens. We can connect a laptop to the screens while people are waiting after they've gotten their vaccine. And so we can think of creative ways and messages we can incorporate nutrition and wellness and other health messages as people are waiting. So we're thinking about that too. And,
Well, you guys know I've repeatedly come out to you to be a part of that. So I think that's a good idea. And I could stand behind talking about nutrition to my community.
Thank you.
There's a lot of great stuff going on. Any other questions for the health department? Ms. Johnson.
Thank you. I just had it was more of a moment because we've been talking about the vaccine and intergenerational households and thank goodness that we're seeing great rates in Norwalk. And just for folks listening, I just have heard, there's some confusion around what the vaccine actually might do to you, especially with people's response to the second shot. And I'm just wondering if there's some information, Deanna, that we can share about how a vaccine does not make you, I'll let you're the expert say, but one of the things I've heard is that people say, well, the vaccine makes you infectious to other people. And yeah, that is an example of just clearing something up about that. So I'm wondering if there are things that you can tell folks that will help clarify things. Appreciate it.
And Teresa, I don't know if you want to add, because she's our expert on presenting this information. I don't know if you want to start.
Sure. So I think it's important for people to know that feeling ill after they get the vaccine is actually a good sign that their immune system is responding, and not necessarily, we have a very similar conversation with folks for years about the flu shot, right? So they get the flu shot and then they start to feel sick, and that's actually really just showing that their immune system is responding in the way that the vaccine is meant for. So for both of the mRNA vaccines that are available, the Moderna and the Pfizer vaccine, there is no virus. For any of the vaccines, there is no virus introduced into your body, and so therefore you couldn't be you're not infectious because you're not getting the coronavirus. You're getting something that will prime your immune system to respond if it ever does see the coronavirus. So I think that's one thing to show. But I think when people start to feel sick in a way that has been described as symptoms of COVID, they might start to get really nervous that, they just got the vaccine that has the word COVID in it, and now they're having COVID related symptoms. Is this something they have to be worried about? But it's really just your immune system responding to that vaccine, and recognizing the material that is meant to prime it, to make sure that when if coronaviruses or COVID-19 is introduced into your system, that it will respond quickly and forcefully to tamp down the illness before it does become infectious. In fact, one of the things they're finding is that once people are fully immunized, because your immune system hits it faster if you get exposed, then you're not as likely to transmit it, because the immune system is tamping down that viral load before it gets to the point where you can transmit it to other people. So we're not 100% sure, how well that's going to work, but that is reflected in some of the CDC guidance that came out, where once you're fully vaccinated, it's safer to be around low risk individuals, even if they haven't been vaccinated, because they believe the vaccine is really going to cut down on transmission as well.
Thank you very much.
Excellent. Any further questions? All right, thank you both for joining us. And then I think the last discussion item is the police department.
And actually, Nick, I might have missed it, but I think we might have missed the two authorizations I actually had on the agenda. I had one that I was asking to go off the agenda, but I have a grant that should have been on the agenda.
I may have been reading off of an older agenda. One moment. All right, I don't want to hold you up while I'm looking for it. Do you want to read it in?
You want me to read it to you?
Yeah, please.
Would that work? All right, hang on. I have it here somewhere. If I could. Okay, so the first 1A is authorize Mayor Harry W. Rilling to execute any and all documents necessary to accept funding from the Justice Education Foundation, Inc. under fiscal year 20 Project Safe Neighborhoods Grant Award in the amount of $5,000. And then 1B is to authorize Chief Thomas Kohalwick to execute any and all documents necessary to implement fiscal year 20 Project Safe Neighborhoods Grant Award. So this is a grant we were invited to apply for through the U.S. Attorney's Office. And unfortunately, we didn't get as much money as we would have liked, but it's still a little bit of money that will help us toward hotspot patrols in times when there's been violent crime. The grant was related to violent crime.
Thank you. Did anyone receive the agenda with those items on it? Okay, so it is on record. All right, so I'm reading off of an old one, so we don't have to make a motion to amend the minutes. So would anybody like to make a motion to move that item forward? Mr. Saranides. All right, any questions on the item? Ms. Johnson.
Thanks, and thanks, Deputy Chief. I just wondered if it was meant for patrolling hotspots that in a preemptive way, or is it for work after a violent?
We can do both in terms of, so again, there's very little funding there. So likely it will be used more toward sites of where there has been violent crime. So we can put extra patrols out to try to calm the fears in the community after incidents.
Thank you.
Any other questions? Oh, Ms. Revelous?
Off the bat, just off the bat, what would be one of your sites?
That would depend on where the crime were to occur. So,
Understandable.
Yeah, it would all be based on if we were having some shootings in a specific area, shots fired in a specific area, things like that, then.
So it's not like past.
Some extra patrol out related to that.
So it's not based on past. It's based on once you get it.
Right now, it would be with that limited funding. Yes, it would be more toward that.
Gotcha. Okay. All right.
Any other questions? All right, we have the two items moved together. All in favor? Opposed? Abstentions? All right, unanimous. Thank you. I apologize for that. So now we can move on to the discussion item.
And I know there were some questions, one specifically related to our Spanish-speaking population. And I just wanted to make it clear, so Lieutenant Dinho is our liaison with the Latino community as kind of a point person, and he kind of takes the lead on community outreach and has done quite a few interviews with the Spanish media and things to try to get word out and try to make people more comfortable. Obviously with COVID, you know, our community outreach has been a little hampered with that, obviously. But in terms, we have over 20 officers who are Spanish speaking. And then we also will call in other officers from other jurisdictions, should we not have somebody working and there's a language barrier. And also for calls coming into the police department, if we do have a couple of Spanish speaking dispatchers, but should we not have someone who could translate, we also use language line.
Just for the record, Ms. Johnson had prepared some questions prior to the meeting. Those aren't included in the backup. So Ms. Johnson, would you mind just asking the question publicly so anybody viewing knows what that was in regards to?
Sorry.
It's all good. Thank you. Thanks, Chair. Thanks, Deputy Chief.
Absolutely.
Yes, I have some questions that came from constituents, community members on their behalf about access to Spanish only language when it came to Norwalk PD, especially if there was a dedicated Spanish helpline with Spanish speakers on the other end. If there's, the ability to have somebody come to a call that can speak Spanish. I've just heard of some anecdotal evidence where there were times when that wasn't necessarily the case. I'm also hearing that sometimes there's a lack of understanding when interacting with officers because people are not just Spanish dominant, but Spanish only, things like that. So it's great to hear a little bit more about that. And then relatedly, to just publicly remind folks, I know we're not in Spanish right now, but this idea, and for Haitian Creole or in any language, that if you are an undocumented resident, you do not need to prove status. So that would be something I think would be great.
And so we have that integrated in, well, one, it's Connecticut law that we don't ask immigration status, but we have it also incorporated into our policies. So it's ingrained in how we do things. Officers aren't asking immigration status. It doesn't have a bearing. And there's protections there. So
great. And they're trained on that specific thing, I imagine, because it is.
Yes, they've been trained on our directives. Yeah. So
that's
and it is. And we periodically will do reminders related to. So, we want to make sure that people are comfortable coming to us. So it's about, they don't need to be concerned if they're not legal citizens, because we want them to report the crime to us. We don't want them to be repeatedly victimized because they're afraid of being deported. So we have previously we've done a tremendous amount of outreach. We at some of the different with different groups and things, outreach to the Hispanic community to hopefully get a better understanding of that, and that we really are here to help, and they don't need to fear anything related to their immigration status.
Thank you. And I don't know if that's the lieutenant, because I see your name, Deputy Chief.
Oh, that's Deputy Chief Walsh. For some reason, the link was sent. It did not.
That's right. Hi, Deputy Chief. How are you?
Hello, how are you?
Good, thanks. I appreciate this. And I just think that I know as in every kind of institution, there are always folks that that will fall through cracks. And so I think for those folks, hearing that there's somebody there who will speak Spanish on the other end of the line is crucial. So in case somebody doesn't have that experience, is there some, like the liaison, is there somebody they can go to, like a number they could call to make sure that they say leave a message in Spanish and they're not sure if it got through because the automated response is in English? Is there a way they can double check with the Spanish speakers?
So Lieutenant Dinho is our liaison. So he works in community police services. So he can field calls if
You could do that.
necessary.
Great, thank you. That's great. And the only other, not really a question, but concern I've had over the past week from a couple folks who've reached out is, given the rise over the past year in anti-Asian harassment and hate, I don't think we've had any reported incidents of that here in Norwalk through the Norwalk PD, but I'm wondering what you all are thinking in the department about protecting all of our residents, especially with the rise in that nationally in these instances in Georgia and so forth.
Obviously, we take hate crimes very seriously, and actually anything that we believe may be that, we would have our detective bureau investigate, just to make sure it's thoroughly vetted. We recently had one incident where we thought there might be a connection, and the detective bureau investigator recognized it wasn't, and an arrest was made on it, but it was just a simple breach it was a straight breach of peace. It was not a hate crime.
Thanks very much for that information.
And I do believe I misspoke. I think I mentioned the immigration status is in our directives, and in terms of the state law, it is related to INS detainers and things like that. So I apologize, I misspoke. It is all in our directives, though.
It's in the directives, though, for us.
Yep. So we don't ask.
Ms. Revelous.
For me, I'm so stuck on our Black boys that still are very uncomfortable. So that's a different story. But what I really want to talk about is, because this has come up to me for several different things. How accessible is that language line? Like, can you use it on your radios? Is it quickly obtainable? Because that's also a different type of disparaging that's happening, that people who are qualified aren't getting hired because they're not speaking Spanish when they have the service of the language line, right? But it's not just to the police department. I'm talking about this is happening like throughout. So I was just wondering, how accessible is it for, if there isn't a Spanish speaking officer at the time? I know it's a quick call, but you guys have different radios, different situation. Does it have that kind of accessibility? I don't know.
No, we cannot get language line through the radio.
I didn't think so.
There is not that capability.
So how accessible? So like it has to be like right in the office, right? Pretty much.
What do you mean right in the office? So
like,
we strive to have an officer be able to translate, because that seems to be the best option at the scene. So then there's no miscommunication. If there's an officer who is certified in that language, that seems to be the best option for translation at a scene.
No, yeah, I completely agree. Don't get me wrong. It's just, it's a blanket question that I'm kind of giving to you, but I've been hearing from my constituents from different manners. It's like they're getting overcast because they don't speak a language. And I'm just wondering, for the people who don't speak a language, if the language line is easy and accessible so they can do their job without having just the need of a translator. Of course, and of course now I know that on the field you would use that officer, but just making people that don't speak Spanish or don't speak Creole or even Swahili still very comfortable in their position to still be able to execute.
So again, we normally would call another officer. Before we would go to language line, we would try to have another officer translate.
Yeah, that's what I guess I would mean, because that's what helps to give the person who doesn't have those extra languages the security that they still can work and do what they need to do.
So say if a call comes into dispatch and it's clear that it's Spanish speaking, so they would normally attempt to send a Spanish speaking officer to the scene right from the get-go.
Of course. Let's say, okay, let's bring it away from Creole or Spanish, or because we definitely have several languages in Norwalk. We have 64. So again, if we speak Swahili,
It's gonna be a little tough. Yes, no, there's definitely challenges related to it. We do the best we can in terms of trying to find a translator, or when we can't find a translator, trying to use language line.
So not to push, and I'm leaving that alone, but maybe if in any factor, because I do know the guy from the language line, but if we can use in any functionalities that we can use it, I think we can bring down costs. And the Norwalk itself has an account with it. So if we can just connect in any type of functionalities to use the services, I think it would be helpful so that everyone feels supported wherever they are. That's
yes, when we need their services, we absolutely do.
Right. if you get what if you guys get what I'm saying, though, get what I mean. That's all.
Any further questions? All right, thank you. And I think with that, we have an executive session item on the agenda. Did everyone receive the link for executive session? All right, and Chief Gatto remembered to remind me earlier to text Miss King. So Chief, thank you again.
You're welcome.
All right. I think somebody needs to stay on the line. Anthony, does somebody need to stay on the line as we launch the executive session line, or because we'll have to come back for the vote, or will you stay in here?
I'm going to stay here. So what I'll do is I'll kick off the executive session on my second computer. Once you guys join, I'll make you host. I'll leave. I'll come back to this one, and then I'll wait for when you rejoin this.
And Nick, am I correct that you don't need us in an executive session?
No, you're welcome to join us, but no, I don't think so.
Thank you.
Thank you.
Have a good night.
Have a good evening. Thank
Good
you.
night.
I'll see you guys on the line. For taken. To close out the meeting, do we have a motion? All right, I saw Ms. Shanahan first. We have a motion to adjourn. All in favor?
Aye.
Unanimous. Have a good night, everyone. Thank you.
Good night.
Good night.